So guys, we are live now. I hope I'm audible and video is also visible to you. Okay. Let's everyone to join this live discussion and then we'll start. By the way, what we're gonna discuss in today's live, two special things we're gonna discuss that gonna be very much useful for you. One, what what is there something new in our new batch, that is we are starting from 13th only, and okay, you can join even this batch after till 15, not after, because some of the students gonna join. We are starting the batch at 13, but some of them have requested for 15, so I have allowed it for that. But what is special in this, I'm gonna announce soon. And second, uh, something I got to know that a lot of you ask me questions, right? Like how to do this, what to do this, what after this, and all this kinds of technical question that is related to career. I'm going to tell you something that is kind of conclusion of all of that. Okay. So I hope till now everyone have joined the session, and if not everyone, at least some people. So let's discuss what gonna be new in this batch. So as you know, in most of our batches we cover SAS, then clinical, and then project, then exam preparation, then internship. This time we are introducing complimentary 2 webinars. Okay, so actually these webinars are paid. So we are arranging some webinars also. We are planning for every month, most probably, or every 2 months for sure. What gonna be special in this webinar? A lot of people gonna participate who are working on statistical programmer, biostat, and different role in CRO companies or pharmaceutical. What gonna be the benefit for you? So those who are our students, there gonna be 1 or 2 webinar free for them. Those who are not our students, they can also join this webinar. What's the benefit for you? You can directly ask your question that you're having to a person working in Lilly, LabCorp, Efficacy, okay, working on statistical programmer, biostat, or medical coder, medical writer, or PV on different roles. So we are offering at least 1 or 2 webinar for free for our students. This is something interesting we thought and we have added. Okay, let's assume for right now itself, because this came in my mind and I thought, okay, let's go for it. Webinar is something very interesting. Second thing, a lot of time you have question how to find job, how to do this, how to create CV. Guys, I have already created videos on my channel, and the much I'm getting more information, first by working on this role, statistical programmer, and then by teaching many students, now managing many things. So one thing I got to know, I'll tell you guys, everything is a process. No one is like key. There is nothing as such exist in this world which you cannot do. The only difficulty is when you are starting something, and do you have patience to be in the journey or not, and being consistent. So the people who got success in anything in life, they started first instead of overthinking. What I believe, sometimes we spend 5 or 10 years for doing overthinking. We think a lot. So this I was reading or watching somewhere, ki sometimes our body get exhausted not because of working too hard, but because of thinking so much. I believe in 5 years you should fail in 5 things if you are not happy in your life. If you feel you're not happy with your work or the life you are living, you should at least try 5 things for your career in 5 years. Don't just think, sit and think, look, okay, I'll start something next year or next to next year, next to next year. If you don't put good knowledge in yourself, if you don't bring changes in your life, if you don't bring new skills in your life, nothing gonna happen automatically, right? Maybe something can happen like this, that you got breakup and that become the motivation to start something. Some of your friend told you something that become a motivation to start something. Don't wait for these things to happen in your life. Take the control of your life, that uh, whatever you want to do, it's not statistical program, or whatever you want to do, you want to start going gym, you want to learn guitar, you want to learn new skills. See, what's your problem? If your problem is that you have money, good career, and you don't have happiness, maybe you can learn other things, playing guitar, singing song, playing outdoor game, getting into little bit of spirituality, right? If you don't have money and if you don't have good career, then your first focus should be getting into a good career. Okay, and the very first step uh, of getting into good career is getting good skills inside you, right? Once you get good skills, you get good pay for the skills only. So I hope my thoughts are clear to you. Okay, I haven't checked your chats. So you need to figure it out, guys. uh, I feel initially it is very important to get into good career and have some money, because even in my life, uh, after getting into good career and having some money, my mind got open that I can do a lot more than this, because I was not feeling satisfied there. Even now, like um, I started doing teaching, and still I feel that there is something more into teaching itself. There is something more, or uh, in 4 5 years or 3 4 years, literally, I sometimes I feel bored. Maybe I didn't got the actual thing. So so doing something till the time you feel okay, now this is fine for me. Now this I can do for my lifetime. Till the time you should explore whatever it is. But the basic is first to have good career, first to have good skills, first to get certain level of good money, and then exploring what else you need. You need good body, go to gym. You want to do a business, talk to the people who are into business. You want to become top in the industry, talk to the people who are top in the industry. You want to get into spiritual path, go to Rishikesh and different places. You want to explore life, start, you know, traveling. I feel just sitting at your home and just watching everything online making your life worst, because we are in the trap of comfort zone. We are just sitting watching whole day. It's like mental masturbation. You're doing nothing, getting exhaust, doing nothing but getting exhaust. Instead of do something, fail, and get an idea about a journey, how a journey looks like. The reality is, once you start something good, like once you start learning some good skills or any good things, like I don't believe a skill is only a technical skill. Learning a software which is having a direct career is a skill. I believe everything is a skill. Learning guitar, learning how to maintain a good body, everything is a skill. Be expert into something where you can build your career for long term. And the ultimate goal is to do something which makes you happy, right? Which gives you money as well and makes you happy. That is the ultimate goal. I don't force anyone and tell anyone to do this or do this, but initially you should do something which brings some money in your pocket, and then you can focus peacefully what is something which you love to do. So Let's take some of the comments. The first comment is, let's play chess. Hello, Pharmajan. Sir, for fresher, online or offline batch, which is best? See, to be frank, I'm teaching, it's been 4 to 5 years. In last batch only, one of the student, last to last batch only, 3 of the students, they asked, they were from Maharashtra actually, 4 or 5 of the students, they asked, sir, like our communication is very bad, and English is also bad. Will we able to understand all this online? I told, do one thing, just join online. If you feel uncomfortable, then come offline. No worries. Okay. Further, you can continue offline. It's about like the training is about to complete, almost complete, and none of them called me. None of them called me that they want to come offline. This is the case. So believe me, our training, we can record this conversation. I don't delete my live discussions. Is designed in such a way the trainers are so good, they are passionate about uh, teaching this for this role, that you won't face any difficulty in online. There is no difference in online or offline if you are taking training from us. I'm not sure about others, but this is what I can say. शिवम पूछ रहे सर, शिवम पूछे सर आपके इस साल स्टूडेंट्स नहीं लगे? शिवम, मुझे अप्रॉक्स 5 साल हो गए होंगे. बिलीव मी, ऐसा कोई इंस्टीट्यूट नहीं होता जिसके सारे स्टूडेंट सेलेक्ट हो जाते हैं. हर साल ऐसा होता है कि कुछ स्टूडेंट सेलेक्ट होते हैं और कुछ स्टूडेंट सेलेक्ट नहीं होते. सेम इन कॉलेजेस, राइट? अगर कहीं पे भी कोई एजुकेशन या कोई भी इंस्टीट्यूट चल रहा है, वहाँ पे सारे बच्चे सेलेक्ट हो जाए तो वो तो मैजिक हो गया, मैजिक. सो शिवम दुबे, आप टीच नहीं कर रहे, मैंने सुना आपको क्लिनिकल का नॉलेज नहीं है. शिवम, एक्चुअली क्या हुआ था, 3 या 4 महीने पहले बैक टू बैक चीज़ें चल रही थी, रिनोवेशन और अलग अलग चीज़ें चल रही थी. उसकी वजह से मैं टीचिंग पे फोकस नहीं कर पा रहा था. फिर मुझे बाद में ये चीज़ समझ में आई कि जब क्वालिटी की बारी आती है, तो लेट्स सपोज आई एम डूइंग दिस सर्विस, राइट, कि हम टीचिंग का काम कर रहे हैं, तो इट शुड बी बेटर. सो आई नीड पीपल हु कैन बी देयर, क्योंकि मुझे क्या मैनेज भी करना पड़ता था, राइट. और उसके बाद स्टूडेंट्स के Q&A कॉल्स भी कभी कभार होते थे, फ्रेश स्टूडेंट्स, एग्जिस्टिंग स्टूडेंट जिनके इंटरव्यूज़ चल रहे हैं, उनके इंटरव्यूज़. तो सारा काम शिवम मुझे ही मैनेज करना पड़ता था. तो जो 3-4 महीने पहले ऐसा हुआ कि मैंने देखा एक बैच में लास्ट का जो पोर्शन था वो ख़राब हो गया, क्योंकि मेरे पर्सनल लाइफ में बहुत मैश चल रहा था और प्रोफेशनल लाइफ में भी बहुत सारी चीज़ें एक साथ आ गई, टू बी फ्रैंक. तो उसी वक्त हमारा ऑफिस का रिनोवेशन चल रहा था, उसी वक्त कहीं 2-4 चीज़ें फंस गई थी, दैट आई कैन नॉट शेयर ऑनलाइन. तो उन चीज़ों के होने के बाद मुझे पता चला कि यार, अगर मैं कहीं फंसता हूँ तो ये एकेडमी कैसे रन करेगी, हाउ इट गोना गो, राइट. मैं कहीं इन्वॉल्व होता हूँ, कहीं मल्टीपल चीज़ें आ जाती है. दैट्स वाई वी नीड अ टीम. सो वी हैव बिल्ड अ टीम ऑफ specialized people who have good knowledge, who are expert into that, whatever they are doing, for each of the thing. दवा भाव, व्हाट इज़ द फ्यूचर ऑफ मेडिकल कोडिंग? ऑलरेडी मैं इसके ऊपर वीडियो बना चुका हूँ. दवा भाव, मेडिकल कोडिंग और स्टैटिस्टिकल प्रोग्रामर. बट व्हाट आई बिलीव, इफ़ यू आर स्टार्टिंग योर करियर ना, स्टार्ट फ्रॉम एनी रोल. इट्स नॉट लाइक कि आपको इसी से स्टार्ट करना है या किसी एक स्पेसिफिक से स्टार्ट करना है. यू जस्ट स्टार्ट योर करियर फ्रॉम एनी रोल एंड देन लुक अराउंड कि जिस इंडस्ट्री में आपको काम करना है उसमें और कौन से रोल है जिसमें अच्छी स्किल्स है और अच्छी ग्रोथ है. शिवम, मैं बैंगलोर टाई अप नहीं करने गया था. सो 2 रीज़न से मैं गया था. एक तो वहाँ पे आर्ट ऑफ लिविंग का आश्रम है, क्योंकि उस टाइम पे बहुत सारी चीज़ें अप एंड डाउन चल रही थी। आई वांटेड सम पीस, तो आर्ट ऑफ लिविंग का इंटरनेशनल आश्रम है, मैं वहाँ गया था। दूसरी चीज़ रक्षाबंधन था उस टाइम पे, राइट। सो माई सिस्टर इज़ लिविंग देयर, तो मैं वहाँ पे ही था, उन्हीं के घर पे रुका था। और काफ़ी सालों से हम मिले नहीं थे, तो मिलना भी हो गया। प्लस वहाँ से हम गए थे विशाखापट्टनम तिरुपति बालाजी, वहाँ भी थोड़ा घूम के आए और थोड़ा तमिलनाडु घूम के आए। तो क्योंकि काफ़ी सालों से मैं बाहर नहीं निकला था और बैक टू बैक ऐसी चीज़ें चल रही थी कि मैं काफ़ी एग्जॉस्ट होता जा रहा था, तो हमने यहाँ पे टीम रखी और मुझे थोड़ा सा टाइम मिला, तो मैं थोड़ा बाहर जाके आया। ऐसा कुछ टेक्निकल बड़ा काम नहीं था, मतलब माइंड फ्रेश करना था, टू बी फ्रैंक, ठीक है। टाइप करने नहीं गया था यार, टाइप करने जाता तो मैं आपको यही मुँह पे बोल देता, इसमें क्या शर्माना। और टाइप किस चीज़ के लिए करना, मुझे वो बताओ। आपको गेस करने की क्या ज़रूरत है, मैं आपको मुँह पे बता सकता हूँ। आई होप यू गॉट क्लियर। चलो आगे कमेंट लेते हैं। गुड इवनिंग वैभव। शिवम दुबे बोल रहे हैं कि आई एम नॉट सेइंग ऑल स्टूडेंट्स बट एनी स्टूडेंट गेटिंग इन सेम फील्ड। आई चेकड योर लिंक्डइन, आपने पीवी और सीडीएम के पोस्ट किए हैं। पीवी और सीडीएम के पोस्ट किए हैं ब्रो, पीवी के पोस्ट मैंने कब किए। 99% ऑफ स्टूडेंट्स अपने स्टैटिस्टिकल प्रोग्रामर रोल पे सेलेक्ट हुए हैं और 1% सीडीएम में सेलेक्ट हुए। उसके अलावा कुछ एक आध परसेंट कोई दूसरा रोल हो सकता है। मैंने एक पोस्ट डाली है, वो जाके चेक करो। कुछ स्टूडेंट के हमने डेटा कलेक्ट किया था जिनकी डिटेल्स अवेलेबल थी, उसमें शायद 20 या 30 स्टूडेंट का हमने एक साथ कंपनीज के नेम के साथ रोल डाला है। जाके ज़रा स्क्रॉल करो अच्छे से, नहीं तो मैं अपने टीम को बोल दूंगा, वो आपको शेयर कर देगी। देवा भाव बोल रहे हैं आपके एक्सपीरियंस से बताओ कि सैस वर्सेस मेडिकल सैस नहीं, आपके एक्सपीरियंस से बताओ सैस वर्सेस मेडिकल कोडिंग फील्ड का फ्यूचर। सी, ये सैस वर्सेस मेडिकल कोडिंग नहीं है। द रोल नेम इज स्टैटिस्टिकल प्रोग्रामर। सैस एक टूल है, और अभी सैस के साथ आर भी आ गया और कहीं कहीं पाइथन भी आ गया है। सो द रोल नेम इज स्टैटिस्टिकल प्रोग्रामर। वहाँ पे चीज़ें टूल्स, या टूल्स ना बोल के मैं सॉफ्टवेयर बोलूँ तो सॉफ्टवेयर इवॉल्व होते रहते हैं। तो ये चीज़ है। शिवम बोल रहे हैं सर आपका एक्सपीरियंस है बता, नहीं सर ऑन्कोलॉजी का नहीं पता। शिवम सबके क्वेश्चन ले रहा हूँ ना, आपके अकेले के ले लूँगा फिर बाकी सबका क्या होगा। एक एक करके रुक जाओ, लेट्स टेक एवरीवन्स क्वेश्चन। हाँ सर, आपको 6 ईयर का एक्सपीरियंस है, आप एडम का तो बताओ थोड़ा ऑन्कोलॉजी का। तो शिवम मैंने ऑन्को के प्रोजेक्ट पे काम नहीं किया है, मैंने कुछ प्रोजेक्ट्स पे काम किया। उसमें एक मेजर प्रोजेक्ट था रीनल, जो कि किडनी के ऊपर होता है। तो ऑन्की के प्रोजेक्ट के लिए हमारे पास डिफरेंट मेंटर्स हैं, लाइक पैरेक्सल से, लिली से, डिफरेंट कंपनी से, और वो अलग अलग प्रोजेक्ट पे ट्रेन कर रहे हैं, डिपेंड अपॉन रिक्वायरमेंट। मास्टर डिग्री इज़ कंपलसरी। अच्छा, आपको ऑन्को के प्रोजेक्ट में इंटरेस्ट है शिवम, इज़ इट ऑन्कोलॉजी के? शिवम लाइक शायद मैंने बताया कि अब मैं ट्रेनिंग नहीं कर रहा, शायद आप अवेयर नहीं हो। अभी शायद मैंने 2 मिनट पहले ही बोला। वैभव, मास्टर डिग्री इज़ कंपलसरी। सी वैभव, master degree is not compulsory, it is something like good to have. Let's suppose if 10 to 20 people are there, and if company wants to filter, what they will do, they might choose the people who are having master degree. They might choose. Bachelor's makes you eligible, but if they want to filter, if more number of people are there, so they can put any filter which can let them in better candidates. शिवम, आप कौन से महीने में ली थी आपने? आई एम डैम श्योर ये 2-3 महीने पहले की बात है, जब मैं बैंगलोर गया था उससे पहले की बात है. Okay. सो यहाँ पे नित्यम, गुड इवनिंग सर, when will I get to see next webinar, and also about how do we join for internship in CSA? Nityam, we are planning now to do webinar every month, most probably. And next thing, we'll announce about the webinar on YouTube as well, on LinkedIn as well. And about the internship, if you have my number, you can directly call me. I can give you the details for internship. Okay. So I think Harish have done some comment. So guys, come on. If you have any more questions, you can ask me, or else we'll end this live discussion. Okay. So guys, I think let's keep this live till here only, and let's check the live sessions. I'm not able to see any new comments. Let me filter it out. Okay. So guys, I don't know, I cannot see any new comments. Let me recheck if all good. Okay. Nityam is asking, sir, clinical science programmer versus statistical programmer is any different lies? Nityam, this is a confusion. Both the roles are same. Clinical science programmer is actually statistical programmer only. So statistical programmer was earlier known as, this role was earlier known as clinical science programmer. Now it is known as statistical programmer. Why the name they have given clinical science programmer? The clinical term came from the industry, clinical or pharmaceutical. SAS was one of the software that was used for data analysis. and programmer because you do programming. That's how the role name was given. But nowadays companies have started using R software as well, and some companies have started using Python as well. Now what happened once they started using R as well and Python as well, so a lot of people get confused ki the role name is clinical SAS programmer, it seems like SAS software. That's why they have updated the role name to statistical programmer. So now it is known as statistical programmer. And the major reason they have given this role statistical programmer, because while analyzing the data, we run some statistics on the data. And programmer because either you use SAS, either you use R, and either you use Python, you're gonna do programming, right? That's why statistical programmer. Someone asked in the Shaitan is asking, I don't know anything about the math. I completed pharmacy this year. I'm able to learn, sir. See, after the invention of calculators, you don't need to know calculation. Same, after the invention of computers, you don't need to do calculation or run statistics or do mathematics. You just need to operate the software. If you know how to operate the software will, you just need to give a command. Once you give the command to the software, it will automatically run the math or statistics for you. Okay, I hope it is clear. So you need to learn the software. Prosenjit, I sir just wanted to know when you decide to switch to IT and why you choose SAS clinical. See, Prosenjit, it was not my sorry, it was not my like decision. Initially, it was not my decision. It became part of my journey. Okay, while I was, let me correct it. So what was happening when I started my journey? I was not liking what I was doing initially. So initially, I have learned many things, and then I got to know about this role, clinical SAS role. Then I learned this as well, and fast forward, I found this was one of the uh, highest paying job and having highest growth job for me. So ultimately, it was the part of my journey. But before that, I have tried many things. Clinical SAS was not my one of the first career decision or last career decision. Before that, I have made many decisions. Okay, so this is why you should try, right? You should try multiple things, and maybe uh, you might get to know what is something good for you. So I have tried multiple things, and one of the role was clinical SAS earlier, right? Prosenjit, your story is inspiring. Inspiring. I saw old videos. Yeah. So in old videos, I have shared a lot of. If you see old videos, now you'll get a lot of clarity. Even I feel because earlier I was having a lot of memories related to my journey. Now it's been 5 years, right? Those memories also I feel sometimes it is getting vanished from my memory. At that time it was too much relatable. Uh, but now it's like I'm not experiencing that phase, right? Everything changed. My life got changed. My day-to-day activity got changed. At that time, struggles and I was always closer to zero. Okay, so yeah, it was too much relatable. Now the phase is changed. Now, until unless you reach to this phase, it's difficult to relate. But still, I can share you some of the information which can be useful to you. Pratik is asking, sir, what's your salary? See, last month I took 20 or 30,000 maybe. So now it's not about salary. We are a group of total 6 or 7 people. Okay. So I'm running an institute. The name is Clinical Study Academy. So we are having 4 to 5 passionate working professionals working in biostat or statistical programmer role, and then some operations team, then editors. So likewise, we are a group of 6 or 7 people, and the salary is distributed between each of us. So last 2 months, what happened? I started that batch now with the fees 35,000, and we found kind of it was little bit loss for us, and that's why I have to take little less salary, or else easily I can withdraw 40K. Okay, but yeah, I too we need to pay the rent as well, the office rent, everything. So let's see how it goes, but happy, happy. So let's see some more comments. Okay, okay.